Welcome back. The pandemic and stay-at-home orders affected millions of Michiganders in thousands of different ways. Among those affected are those who also suffer from eating disorders. Amber Bowers from Forest View Hospital is with us this morning to share more. Good morning, Amber.
Good morning.
Thanks for being here. You're the program coordinator of the eating disorder program at Forest View Hospital, so obviously an expert in this area. How prevalent are eating disorders and how deadly?
So eating disorders affect over 30 million Americans, and they're amongst the highest mortality rates of any mental illness. So obviously something that impacts a lot of people.
So 30 million, that's a pretty big number, but the shocking statistic might be that eating disorders are among the highest when it comes to fatalities. So the struggles associated with this disorder, what are people facing, and how has the pandemic exacerbated those problems?
Absolutely. So a lot of individuals who struggle with eating disorders can become so preoccupied with food, weight, body image that it starts to really impact their day-to-day functioning. They may also be suffering from other co-occurring disorders such as depression or anxiety. And in those situations, the eating disorder can often be something that helps them to cope by maybe providing a sense of control in situations where they are feeling out of control, or by helping them to avoid unwanted memories, painful emotions. So it can be used as a way of coping in that way as well. The current pandemic definitely can cause a number of other issues, not just with having to transfer to telehealth, but also the availability of food. And one of the biggest things is also isolation. A lot of times isolation can be used as a way to hide certain behaviors or certain warning signs from others, whether that be family, someone's treatment team, someone else in their support network. So the stay-at-home orders can unfortunately enable some of those behaviors.
That's got to be a struggle for the good work that you do at Forest. So talk a little bit about what you're doing and how you're combating this.
Yeah, so Forest View has a dedicated eating disorder program for both adults and adolescents at the partial hospital level of care and inpatient. It's something that we've also been doing virtually in the partial hospital program to try to help provide that support in this time. We really focus on nutrition, learning positive coping skills, and helping improve body image as well.
Yeah, the anxiety level, I'm sure, has gone up for many of us over the past few months. And for those with eating disorders, as you mentioned, that can be a bad combination, especially when people can't come in and check up on them. Now, Forest View Hospital, you guys are open, 24 hours a day, 7 days a week to help anybody struggling with this. It's really a mental health issue as well, isn't it?
Absolutely. So we do have a dedicated program specific for eating disorders, but within that program, we also address other mental health issues, and we have our general programming to help anyone who's struggling with mental health issues, and available, like you said, 24/7.
And this is something that we can do for each other. Obviously, with the pandemic, people being stay-at-home, quarantined, all of those things, check in on those people that may be struggling. And make sure you're checking up on them and helping them out. And if you know of someone who needs help, you can call the hospital, 1-800-949-8439, or just visit their website, forestviewhospital.com. Amber, thank you so much for the time this morning. Thanks for joining us.
Thanks for having me.
Absolutely.